Mehta oration. Dr. Banshi Sahu, Chief Diabetologist Chairman, Diabetes Diabetes Care and Harbour Clinic, Ahmedabad. He has just been elected president. He has just been elected as the president of International Diabetes Federation Southeast Region, and he is the past president of National RSSDI. So quickly moving on to Dr. Banshi Sahu sir for resolution. Thanks a lot, sir.
Good afternoon, Jabalpur. First of all, thank you, Parimal and Dr. Abhishek for wonderful hospitality. Beautiful city, very, very green. I am sure all of you have taken your tea so that you will be able to listen my talk for next 20 minutes. Thank you, Dr. J.K. Sharma sir, Dr. Makkar Saab, Dr. Anush Maheshwari and Dr. Manoj Chawla. All of them are National Executive Committee member of RSSDI. Being a past president of RSSDI, we have done a national campaign for preventing diabetes, early diagnosis of diabetes. And the whole idea was that how we can prevent diabetes. And today what I am going to talk is primarily to primordial prevention of diabetes. This disease is really shaking our foundation across the country, across the globe. India and Southeast Asia, we are having highest number of people with diabetes, and it is increasing day by day. I mean, next to China, if you see after the Pacific region. But if you want to primordially prevent diabetes, we have to think something differently. We have to intervene very, very early. Not like someone who is already at the risk of diabetes, not someone who is already pre-diabetes. We have to think someone who is even before it, because all of us are at the high risk of developing diabetes. Number of people developing diabetes, this idea catalyst you must have seen since morning, and also in last couple of years must have seen these slides multiple times showing that India, Southeast Asia, Pacific regions across the world, the number of people with diabetes are increasing. Even whatever we are doing, whatever best we are doing, still we are not able to prevent diabetes across the world. This is one slide which is very important from India. It is published showing that we have 101 million people with diabetes. We have 136 million people with pre-diabetes. We have dysglycemia, hypertension, abdominal obesity. These all are multiple risk factors for cardiovascular disease. So this is the problem. If you see in this hall, if there are 150 people are there, out of them all of are adults, we will have at least 30 to 40 people may be having diabetes or they may have pre-diabetes. But if I just put the central obesity above the age of 30 or 40, almost every second person here is also centrally obese. The problem is that we are developing diabetes early in the course of the disease. I mean, in their young age, in the 25 to 30, we are developing diabetes almost 2 decades earlier than the Western population. And that's the problem, because more the years of diabetes, and that's also type 2 diabetes, more the risk of cardiovascular disease. But in 40 and 45 or in 50, we see a lot of people developing diabetes. There was even data from Delhi, and it had shown that above the age of 40, almost every second person in Delhi is centrally obese, and that's what makes him for a higher risk for cardiovascular disease as well as for diabetes. This is what hyperglycemia in pregnancy. We also have a more problem that we develop hyperglycemia in pregnancy compared to other regions of International Diabetic Federation. Southeast Asia has shown highest number of people with hyperglycemia in pregnancy, and that is also responsible for increasing risk of diabetes in their adult life. Once these children who are born with the people with hyperglycemia in pregnancy, they are at the high risk of developing diabetes throughout the lifetime. So today India is not just suffering from influenza, rather we are suffering from a very affluent problem, that is what we call it affluenza. So you know, we are having now increasing calorie intake, less physical activity, more of stress, and that's the reason for increasing our central obesity. So the life course approach for prevention of non-communicable disease, or you say about the life course of a prevention of diabetes, at every stage there is a possibility that you can decrease or you can prevent the diabetes, even at the level of fetal life, infancy, adolescence, and even adult life. So at every stage you have possibility to prevent the diabetes, not at the time when somebody has already developed pre-diabetes or someone who is already now centrally obese. So you have to work on those fetal life, something which we have to do to prevent diabetes. So primary prevention we all know, from pre-diabetes to diabetes if we are doing, but primordial prevention means someone at the making normal population, or normal population should not become diabetes. That is what primordial prevention, or we don't want someone to become even at a risk of developing diabetes. That is what we will call it, say, primordial prevention. This is global MAPE, which is talking about the birth weight according to WHO data, and you will be surprised it is the Indian subcontinent, only Indian subcontinent across the world having the less birth weight. So I mean the birth weight of a average Indian or in Southeast Asia is around 2.8 kg. This is to our surprise. While the Western world or anywhere in the world it is around 3 or 3.2 kg. So this is a huge difference. We have low birth weight child, and this low birth weight child with undernutrition under the age of 5, we are the highest number of people in our country, highest number of these young children. While other side we are also having highest number of diabetes. So it means there is some connection between underweight, low birth weight child with the nutrition, which is a problem at that time, and simultaneously we are also getting diabetes in the adults. So this combination, this correlation is very, very important to understand if we want to primordially prevent the diabetes in our country. One more very interesting data by Dr. Yagnik, he had shown the child born in India is 2.8 kg, but his fat percentage is more than 25%. So even child which is born low birth weight, the fat percentage is higher, while a British baby or a Caucasian baby whose weight is 3.2, but the fat percentage is a 15%. So this is what thin fat Indian, and this concept we get from the childhood, from the newborn, this thin fat Indian baby which we have, and this continues even at the adult life. And this is also YY paradox, which we know that even in adult life, the Dr. Yagnik and Yudkin had shown that Yagnik having fat percentage of 21.2%, while Yudkin is having only 9.1. So this is the thin fat Indian, and that is responsible cause for increasing diabetes. And this starts from newborn. This starts from someone who is at the time of birth itself, there is a fat percentage more. So we have central obesity higher, we have less muscle mass, we develop diabetes 20 years almost before, and we have higher fat percentage, and this is typical thin phenotype of India. Now what happens? A child who is born low birth weight, actually he should be given more of a increasing growth, increasing bone mass, increasing muscle mass. Rather what is happening? We are increasing his fat, and that adiposity increases the risk of fat, because complete family is trying to feed the child. They think that child is low birth weight, let us feed the child and increase the birth weight, the weight of the child. While ideally what we should do, we should increase the muscle mass and we should increase the bone mass. And if we don't do that, what will happen? This life cycle of diabetes will continue. A low birth weight child will become overweight early in that course, and then in adolescence she will become more obese. That will lead to PCOS, malnutrition. Once she will become pregnant, again hyperglycemia in pregnancy, GDM, she is going to deliver either a baby which is large, which have higher fat percentage, or a low birth weight baby which is again with a higher fat percentage, and will again make her more possible that she will become diabetes in her adult life. So the womb is very, very important, more than a home, and we have to create a healthy womb with healthy babies. I can see here many young girls who are sitting here from our nursing college, and they should understand that the womb is very important, and we have to make the healthy wombs. After 5 years, 10 years, 15 years, when you will become mother, or my girl who may be 12-year-old or 10-year-old, if I have to make her healthy, I have to start working now. We have to increase her height, we have to increase her body mass, we have to send her for more sports activity. She should become more sporty, her fat percentage should decrease, her muscle mass should increase, and we should make her healthy mom now. So after 10, 15 years, when she is going to deliver the child, the birth weight of the child should become normal, maybe 3 or 3.2, with fat percentage should decrease. So the birth of it is not only responsible for diabetes. Other non-communicable diseases are also responsible with these low birth weight child. They have higher risk of cardiac disease, even higher risk of respiratory problem also. So prevention of diabetes, the solution is preparing every female child for a healthy motherhood. That's very, very important concept. I think this is the only one sentence which I want to tell here, that for primordial prevention of diabetes, we have to prepare every female child for a healthy motherhood when she